Hi everyone. I lost my videos, so can you guys just like tell me in the chat if you can see and hear me? Can you guys see or hear me? Okay, yay, thank you. For some reason it says on the back end that we're having problems with the video. So I just want to make sure you can hear me. Yay, okay, muy bien. So hi, I'm Isa. I am the founder and executive director for Chicago Latina Moms. And like about a month ago, we had a lot of conversation in the CLM Facebook group about, um, the vaccine and if people felt comfortable getting the vaccine. And there was a lot of questions, maybe even some misinformation, a lot of links being shared from the CDC and studies. And so we thought that it would be a great opportunity to bring in some experts and professionals who do the science, who are on the front lines, and to answer our questions, because we're learning everything sometimes minute by minute, especially as moms trying to be parents and work and try to foresee what's coming ahead. So I am so excited to introduce our panelists. We have, and this is really exciting for me to say, Doctora Susie Lopez and Sabina. Sabina, is your camera on? Yay, okay. Hi.
Hi.
You guys hear me okay? Yay, okay, great. Thank you so much for being here and just sharing your experience, your wisdom with us, and Latino families. So if you guys could please introduce yourself. Sabina, do you want to introduce yourself?
Sure. Hi, I'm Sabina. I actually live in Toronto, Canada, so I'm a Canadian represent. And I am the founder of Unambiguous Science, which is a evidence-based science page where I try and dissect and get information out in an easy to understand way. I'm also the co-founder of the South Asian Health Network here in Toronto. We've been doing a lot of work on public health information around COVID, as well as COVID vaccines, and also making sure that it's language accessible for our communities, and also advocating for the health and well-being of our communities. Thank you for having me today.
Thank you so much, Sabina. And if I can introduce Doctora Susan Lopez. Susie and I actually went to high school together, and we were just talking about when was the last time, that we were in high school. It was almost 2 decades, I'll just say it like that. So, Susie, do you want to introduce yourself, please?
Yeah, hi, I'm Susie Lopez. I'm from Chicago, from the little village in Cicero area. Long route, non-traditional to get to medicine, but I did my training, medical school at UIC. I'm trained in internal medicine at Rush University Medical Center, where I still work. And I actually don't have clinic. I only treat hospitalized patients. So pretty much literally a year ago, I think I was working nights and admitting patients onto the COVID floor, some of the first patients at Rush. Just seems like forever ago, but not that long ago. I've done a lot of community outreach throughout the spring and summer, kind of giving people information about where to get testing, what kinds of things to do, how to protect themselves. And then more recently have been doing a lot of community outreach regarding vaccines, trying to ensure that they are both, the information is culturally competent. It's to the level, for the community, but also in their language. I'm part of the Impact for Healthcare group, which is a network of physicians that kind of advocates. We write letters to Governor Pritzker and whatnot to try and advocate for patients and for policies that are going to help make things more equitable. So yeah, that's me in a nutshell.
Yeah, that's kind of wild to think like how we were kind of learning how real this was a year ago. Like real quick, Susie, can you tell me like maybe like kind of when you realize like, whoa, this is like, okay, if I can share real quick. So I'm a doula, I'm a birth worker. I remember when I went to Rush in February and I had a birth. And I'm a news junkie, so, like, I knew something was gonna happen and that it is gonna appear in Chicago soon, so I was, like, washing my hands obsessively and sanitizing my hands obsessively. Baby was born on a Monday, and sure enough, on Thursday, the first, COVID case at Rush came. So it was only days, and I saw and that was kinda, like, the moment where I realized, like, whoa, this is real. What for you, Susie, like actually being on the front lines, like when was that moment that you were like, whoa,
Yeah,
and also like how it's hitting us Latinos too.
I think it was probably late February. And we were all everyone was talking, trying to figure out like what's going to happen. Is it actually going to come here? But I remember it was kind of like our hospitalist group. We had kind of like a gathering. We were at a bar nearby the hospital, and we got an email, or we maybe heard that the hospital was going to keep us from traveling. And I was scheduled to go to a conference in St. Louis with some of our medical students. And just hearing those whispers was like, it was a little unnerving, but I think where it hit me was, I think it was like March 1st or something like that. I was almost getting on the highway to go to St. Louis. And because the hospital was helping coordinate some of this, they actually called me and told me to get off the highway. You're not allowed to travel. And then we knew like all of our schedules were completely upended. It was one of those things where like all of a sudden the hospital got really quiet because we got rid of anyone who had elective procedures. It was like the calm before the storm. And then that first week, that Thursday, I was probably working those nights and helping admit. And it was like one of those things where you just kind of know something's going to happen. You get that really weird gut feeling. And then after that, it was just an adrenaline rush.
Yeah. What about you, Sabi? You said you're in Ontario. Like, when was that kind of like, oh, this is real? I call it like the movie moment where you're like, I feel like I'm in a movie and this is something you watch on a movie, not actually want to live through, like how was that for you?
Yeah, it was actually similar as well over here. It was around the beginning of March when we had our first few cases as well. And I remember we had a lot of panic because it was right before March break for us. And our premier was still telling people, it's okay, go ahead on your March break. Everything's fine. It's all okay. And then I think it was like halfway through that when we ended up closing down everything, and people were stranded on vacation, and it was very chaotic. And for us, especially in Toronto, it was interesting because we were one of the epicenters for the original SARS. And so outside of for the original SARS, Toronto was one of the hardest hit, and we actually lost quite a few healthcare workers here in the original SARS. And I think that everyone basically at that point was wondering whether this was going to be the same as the first SARS. And I think that people have started getting anxious and also concerned and worried about how things were going to be back then.
Yeah.
And rightfully so, because it's now a year in fact, exactly.
Yeah. No, well, again, thank you both for being here. No más para que sepan, vamos a hablar también en español y si tienen preguntas, you guys have questions, pongan en el chat. Vamos a empezar con preguntas que vimos en el grupo. Y Susi, la doctora, también nos puede explicar en español. Pero por favor que se sienten en confianza, que si tienen cualquier pregunta, que nos digan aquí en el chat y vamos a tener tiempo para contestar todas sus dudas. So I'm just going to start off with like the questions that we like were seeing in the Facebook group, and like just moms and the buzz of just trying to get a sense of like what's happening and who feels comfortable getting the vaccine. I mean, I looked last night and it was only 5 weeks ago, but I feel like since COVID, everything feels like multiplied. It feels like it's been like 6 months ago. But um, I think like one of the first things that I noticed that there was like a lot of just kind of like confusion is like what is the vaccine made of? Like what is a vaccine? Because like I know like when we take our kids, when we get shots, like you get like that whole um ingredients sheet if you ask for it, but like what like could somebody answer maybe Sabi, if you want to answer, like what is in the COVID vaccine? ¿Qué contiene la vacuna para COVID?
Yeah, great question. And let's maybe start with the mRNA vaccines because that's really the ones that are, for the most part, widely disseminated and distributed in the US. I know that you also did get EUA for J&J very recently, which is great. But for the mRNA vaccines, what you have in them are very straightforward. So you have your mRNA, which is your harmless genetic material basically that creates the spike protein. I'm happy to talk a little about that if you guys have questions on what really is a spike protein, what does the mRNA vaccine do? So it has that little component in it, but it also has lipids and cholesterol. And this is really important because it forms like a fat bubble around the mRNA. So it really helps it get into your cells easier because it has that fat bubble. And then the other thing you have are things like sucrose, which is basically sugar. And then you have sodium, salt, potassium, salt. And these actually make it stable and balanced so that when you're getting the vaccination, the vaccine actually remains balanced and stable in your body. And that's really actually all that's there in terms of ingredients in the mRNA vaccines. There's really nothing else that is nefarious, that shouldn't be there. There's no chips, I can assure you of that. What's really key and what's important in that is that little piece of mRNA that will really protect you and protect your body against COVID infections.
Susie, do you want to
Yeah.
add anything? Kind of explain that in Spanish, like.
Yeah, I can explain it in Spanish. I think the only thing that I would add is the mRNA. It's basically everything that Sabina mentioned. The mRNA, it's basically protein. Then you have the fat bubble around it, salt water. It's all stuff you would cook with. There's no preservatives, and which is why it has to stay so cold. The mRNA, I like to think about it like it only lives in your body for a little while. It's like a Snapchat or Facebook story. It's there and then it's gone. So yeah, it's pretty straightforward. So I guess in Spanish, lo que contiene la vacuna contra el coronavirus, las vacunas que tienen la tecnología de mRNA o RNM, es las instrucciones para tu cuerpo que haga anticuerpos, y eso es el RNM, es una línea de proteínas, está protegido adentro de una burbuja de grasitas, colesterol, que lo protege, tiene algunos sales, agua salinada o suero, y eso es lo que se inyecta adentro. No hay nada de preservativos. Es por eso que tiene que estar tan congelado.
Thank you. I didn't think about why it had to be cold. That makes total sense. Another thing that I noticed was like, is the vaccine going to stop the spread? I feel like that's where like a lot of questions like swirl en la pregunta de si la vacuna va a detener que el virus sigue pasando de gente por gente, ¿verdad? And my husband, he says like the vaccination is he calls it like a selfish thing, and there's much better term to put it, but basically like it protects you, but it's not like I'm vaccinated, like you can't get it from me, like, right? Like that's not how it works. Like what does the vaccine stop the spread, and like what exactly is it for? What does it do?
Sure. So So most other vaccines like polio, measles, mumps, rubella, they stop the spread, which is why you barely hear about those diseases, especially here in North America. We don't have the data yet to say it officially stops the spread. We're still gathering information. Sorry, that's the dog. We're still gathering information, but we anticipate, and we're slowly starting to get data and information that tells us these vaccines will likely help slow down the spread. But until we have that information, I still wear my mask. I've been vaccinated and I still wear my mask, and I tell people to still wear your mask. So, God forbid it doesn't stop the transmission. I know that I helped save a life by just making sure I didn't spread it to anyone.
Mhm. So I think
So
that
do you want to add anything?
yeah, and so I think that where the confusion comes is that when we were doing the studies for it, we looked to see whether the vaccines worked or didn't work. We actually looked to see whether the people in the clinical studies had any symptoms of COVID or not. So we just simply didn't look at whether it was able to block the transmission at all. And the reason for that actually makes sense, because we've seen, that with COVID, we're seeing a lot of people who are very sick or hospitalized, people who are dying, people who are on ventilators. And we really wanted to make sure that we were protecting, in terms of the very severe illness, we were protecting people. And so that's why the studies looked at that. But actually with Europe, now that they have quite a few weeks of really good data coming out, especially in several parts of UK, in Israel especially, we're having great data. And it's actually sort of showing us that it is blocking some amounts of transmission. So it's exciting, but again, there's not a lot of data right now. But what we're seeing so far is very reassuring. And I'm hoping that maybe in a couple more months, when we have this real world effectiveness data, we'll actually have a better idea about it. And it's interesting because if you look at the J&J study, the new Johnson & Johnson vaccine, actually one of the endpoints that they looked at in the study was to see whether it blocked asymptomatic. And in fact, they had almost 70% that, it was 70% efficacious in blocking asymptomatic transmission as well. And even actually with the Moderna vaccine, in their trial, they did this thing where they looked at your nasal swabs a week after you got the first dose, and they were looking to see, whether it can possibly stop transmission, and they saw 2/3 fewer cases of asymptomatic transmission in it. So all signs sort of point towards it being good in somewhat blocking transmission at least. But I think we'll get to know more about this later. And I think also really important to know that, even with things like influenza, we talk about this very often. Why should I get the flu shot when I can still get influenza? But even if you do get influenza, if you have the flu shot, then your symptoms are so much less severe. It might be a simple common cold for you, instead of you landing in the hospital, getting pneumonia, having lung damage. All these sequelae are just so important to remember and consider as well. So, I think it's reassuring. We need more time to see what happens. But as Dr. Lopez said, after you get the vaccine, it's still super important to continue to mask and have your social distancing and other things. Exactly, there you go. And so what public health in Canada is exactly in line with CDC recommendations, at least until we can get to that herd immunity that's going to be so important.
Doctora, ¿puedes explicar que lo que estamos hablando de, si tienes la vacuna, no es que no puedes pasar, si te da el COVID, es más que no vas a tener que estar en el hospital, y lo que ven es que si tienes la vacuna, que es probablemente que no vas a tener que estar en el hospital, mucho menos morir de las complicaciones, ¿verdad? Pero todavía, y todavía falta mucho para estudiar, pero que es posible que no detener que puedes contagiar a otra persona, pero tal vez no tan rápido como cuando empezamos, ¿verdad?
Sí, exactamente. Este virus se contagia muy fácilmente Y después de que la gente se están vacunando, que completan las 2 vacunaciones, o con Moderna o Pfizer, o una vacuna con Johnson & Johnson, todavía les estamos pidiendo que usen mascarillas o cubrebocas, y es porque todavía estamos colectando información, datos para asegurarnos que sí ayuda a bajar la transmisión del virus. Entonces, todavía es importante hasta que tengamos mucha información, que tengamos muchos datos para decirnos que sí, de verdad ayuda a bajar la transmisión, que no se vaya a contagiar, hasta que nos digan que es más seguro quitarse la mascarilla. Pero lo bueno, y todas estas vacunas tienen diferentes niveles de eficacia o de ser efectivos. Cuando dicen que las vacunas son efectivos, quiere decir que buscaron para ver que la gente que no tuvieran infección severo. Son efectivos en prevenir infección con síntomas. Ninguna vacuna 100% te va a prevenir que vayas a contagiar cualquier enfermedad, pero lo bueno que hemos visto con todas las vacunas que están aprobadas con autorización de emergencia aquí en los Estados Unidos, Moderna, Pfizer, Johnson & Johnson, todos previenen que alguien vaya a ocupar estar internado en el hospital, o que vayan a estar hospitalizados, o que vayan a morir. Eso es lo que cuenta. Si uno lo contagia, a lo mejor lo va a contagiar, pero no, la enfermedad no sería tan severo, sería más leve. Y lo bueno y lo que nos da mucha esperanza es que la gente no van a ocupar el hospital, y que los números de los muertes siguen bajando.
Yeah, it's like a you know, one of the questions I know that's going to come later is like, is the COVID vaccine going to be like an annual vaccine an annual shot we have to take like we do the flu, right? So it's like, I remember that when I heard Dr. Fauci say like, this is not going to go away. Like, this is just going to be something that we're going to learn to live with. I was like, no, like there's no end in sight. So it's like, okay, like if we get the vaccine, you know, what I'm hearing from both of you is it's not going to like prevent you from getting COVID. What it's going to prevent is from you to get severe symptoms that could kill you or get you hospitalized. And we still don't know how effective it would prevent transmission. So it's like kind of like getting the flu shot. Like, think about like when we get the flu, if you're sick, you could probably get someone else in your household sick. But if everyone has the flu shot or has built enough of the immunity, like but COVID is so new, we don't have that, and it will take probably forever for that, right? Because the flu's been around forever. So I'm just trying to kind of make the connection to something that's like something we know, something familiar, right? And it's like the flu shot.
Yeah, very much so.
And talking about the flu shot. Sorry, go ahead.
Go. No, yeah, the only thing I was going to add was we got to use all of these things that we have in our toolbox, like the masking, social distancing, washing your hands, and the vaccines, because it's like the more chance that this virus has a chance to spread, the more chance it has to mutate. And so, the faster we can get people vaccinated, if they choose to do so, it just makes it easier to help control any creation of variants and suppress any of those variants that we have, just to keep everyone safer.
I'm going to ask about variants because we had a lot of questions about that. But Tina, can you answer this question about if we got the first dose of the COVID and we want to get the flu shot, is there a recommendation to not mix them and get that scheduling tangled? What do you recommend?
I think I might defer to Dr. Lopez on this because I think there might be some regional differences here.
Oh,
okay.
I'm not entirely sure because I know with some of the recommendations with CDC, ACIP is not the same as ours. So I'll see what Dr. Lopez has to say first.
Yeah. So in general, the CDC is recommending that someone waits at least 2 weeks from one vaccination to the next. If my mom got the shingles vaccine, they told her to wait 2 weeks until she got the next vaccine. And the only reason for that 2-week time period is usually the time period it takes for your immune system to respond. So we want your body to just respond to one thing at a time, focus on making antibodies for one thing at a time. So at least you can go ahead and wait 2 weeks.
Yeah, it's the same here as well.
Okay.
2 weeks as well. Yeah, perfect.
Si van a tener la primer dosis de la vacuna, dice la doctora López que se esperan 2 semanas, 2 semanas antes que tienen la vacuna para la gripa. Y luego ya te toca la segunda, ¿no? Porque la segunda dosis del COVID es 3 semanas o depende de cuál.
Sí, la vacuna de Pfizer es 21 días, después de 21 días es la segunda dosis y Moderna es 28 días.
Okay. Well, let's talk about, we were having a really interesting 2-minute discussion with Sabina because she's in Ontario, but she was sharing some stuff that me and Dr. Susie were like, oh yeah, that's very familiar, right? And in Chicago, our most vulnerable populations have been the Black and Latino populations. I know I haven't looked in a while, but when we were doing our community mutual aid fund, at that time, I knew that, for the first, 8 months of us having COVID in Chicago, that older Black men were the highest death rate for COVID, and the highest infection rate was the Latino community. And there's a lot of reasons for that why, and I really want to hear from Sabina, because I think it's really interesting for anyone who's been paying attention to how I feel like the COVID discussions, some people are like, yeah, it's nothing. But what COVID did is it made the issues of, vulnerable and marginalized, neglected communities larger, right? It didn't invent anything. It didn't create anything, I don't think, that wasn't already there. And it just made those problems even more urgent than they already were. Dr. Ed, do you know, just kind of off, just off the top of your head, the most recent data that you know about, right now, who has the highest infection rate and who has the highest death rate? Is it still the same?
You mean for Chicago? I don't know about Chicago specific, but I do know that in general, when the CDC is comparing the rate of infection and then hospitalization and then death from COVID, for the Black patient population, Latinx Hispanic patient population, and the Native Indigenous patient populations, infections and hospitalizations are 3 times more likely compared to their white counterparts. And then death for Native patients and Latinx patients is 3 times, but for Black patient population, it's close to 4 times more likely.
Sabina, can you share with our community what you were telling me and Dr. Lopez, what you're seeing in Ontario that made us go, oh, that's what we're doing, what we're experiencing here?
Yeah, for sure. And you know what? It's actually very, very similar. So again, with us, for us, as you said, what the pandemic has done is just highlighted how much our racialized communities have been neglected for a very, very long time. Our communities have been marginalized and have been sort of set behind for a very long time. And this has just accentuated it. And it's very interesting because people will say things like, oh, we're all in the same storm, but okay, maybe we're all in the same storm, but we're not in the same boat because you have a much better boat than I do, right? And that is the real crux of it. And we've seen similar here. So in the South Asian communities, which actually has been impacted the largest here in Ontario. So 60% of COVID cases here are actually in the South Asian communities, whereas we only make up 30% of the population. And similar in the Black communities as well, we make up 9% of the population, but we're 21% of the cases here. So as you can see, 80% of our cases here are in just predominantly Black and South Asian communities. And then also we have other communities that are impacted. Again, the Latin American, even though we have a small community, it's also, marginalized the exact same way over here. And we also seeing that with our Indigenous, because we do have a fairly large Indigenous community here in Toronto, and it's the same exact situation. And it's interesting because in wave one, we were looking at the data coming out from the US, and we were seeing how racialized communities were so impacted, but we did not collect that data. There was no disaggregated race-based data that was collected in Ontario, and we kept asking and saying, can you tell us what the data looks like? We can see with our neighbors in the US, we can see with our own eyes over here in our own communities that it's impacting us. Why is there no data? And we kept getting told, oh, we don't look at color, and that's just such bullshit, okay? And so then we started looking, finally, after we pushed and we pushed, we started getting this race-based data. And then what ended up happening in Ontario is that the tables were turned, and then we started getting blamed for our high rates of COVID and high rates of death, instead of understanding that there's just so many reasons and factors that were actually resulting in this. And, in South Asian communities have very similar, in terms of structural barriers, because a lot of the employment is, part-time work, shift work, where there's no workers' benefits, there's no protection in terms of masking, there's no paid sick leave over here for majority of the workers. And then, we talk about Canada, about how we have healthcare, but our healthcare is not equitable. Who has access and who does not have access? There's such drastic differences in there. And in fact, if you look at the data, racialized communities have almost 1/3 less in terms of accessibility to healthcare than non-racialized folks over here. And so all of these factors is what's actually causing it. And predominantly in South Asian communities, we are the frontline essential workers. We're working in warehouses, we're working in factories, where predominantly all the transportation and trucking is by South Asians as well. A lot of frontline healthcare workers are South Asians as well. So of course, we're going to have these high rates of transmission, and really not much done to protect our communities. I think that if this case, if we saw COVID, for instance, was impacting the rich white people, I think our response to it would be very different than the way it is, given that it's impacting predominantly racialized people.
I agree. And I feel like it's really hard for me not to kind of when people are like dismissive about like, oh, it's nothing, it's like, it's really, really difficult for me not to take it as like a racist remark, because that's what it is that, like a Black, Brown, Indigenous, a life of color like that is valued less, because you're right, if it were a predominantly white community that was getting hit as hard as some of our communities, like it would be, I think, a lot more outrageous to the country. I remember when I got my first dose, like I just like felt super emotional, because I think at that time we weren't at 500,000, but we were past 450,000 deaths. And I was just like, I just had to cry it out in my car. Like it hurts my heart, it hurts my body, it hurts my spirit, because I know, disabled, Black, and all everything that like, and it's not just the United States or in Canada, all over the world. Like you hear about stuff in Europe about how like if you're disabled, they're like not even going to try to resuscitate you or something like that. So it's terrible. Doctora, can you tell us about like what that Chicago is doing to make access to the vaccine accessible? I know it's a hot mess, because we don't have any centralized system. It's like whoever, these organizations who have the vaccine get it, and they're on their own to manage like the distribution of it. But it's very obvious like who's hurting the most in Chicago. Like, is there anything you've seen or know of that the state, or especially Chicago, is like working on making it more equitable?
Yeah. So Chicago, I mean, it always takes time. I think they at least recognize that there's a problem in equity and getting the vaccines to the people who need them. So aside from having, the first set of vaccines were sent to clinics and hospitals where there were frontline healthcare workers. So that was phase 1A, and we're kind of overlapping with what phase 1B, which is age 65 and older with comorbidities, and then other essential frontline workers. So that's just in general for the city of Chicago. It's really interesting to see, like, literally all the pharmacies and the clinics that had registration places, it's all like you said, it's not centralized. Like, people are registering at multiple websites to try and figure out where they can even get the vaccine or who has the vaccine. The city of Chicago recently moved to ZocDoc for people to help people find vaccines. And it was a great move, but you're still leaving out a large proportion of people who maybe, sometimes my patients don't even have a smartphone, they have a flip phone. So if you don't have access to technology, or if it's not in the right language, you're leaving out a lot of people. But there's been a lot of hospitals that have been having conversations with communities, getting information about what their needs are, partnering with community-based organizations, faith-based organizations, and trying to figure out what their needs are. One of the specific things that Chicago is doing and recognizing that, number one, there were a lot of communities that were really hard hit. So they have, so aside from the vaccine being in phase 1B in Chicago, 65 and older with, medical conditions and frontline healthcare workers, they also have a program called Protect Chicago Plus.
Yes.
Yes.
I actually was going to ask you about that. So if you can answer this one while you're on that too.
Okay, well, we'll answer it. So Protect Chicago Plus, so basically they have a list of 15 neighborhoods that were hard hit. It's like Brighton Park, Little Village, the south side of Chicago. And so they're partnering with clinics and trying to put vaccination sites in those neighborhoods. So it's open to those neighborhoods now. The only difference is the difference between regular 1B vaccination efforts is that neighborhoods with Protect Chicago Plus, it's 18 and over, or if it's the Pfizer vaccine, 16 and over. So anyone in that neighborhood, if you live there, you can get the vaccine. And then the only thing you have to show is just proof that you live there, a bill or something. It doesn't even have to be an ID. They don't ask if you're documented or not, so you don't have to worry about it. The vaccines, no matter where you are in the US, should be free. That's the cost of the vaccine, and you should not be charged by your insurance company for it. They may
no deben
ask,
de pagar por la vacuna.
huh?
Que no deben de pagar por la vacuna, que debe de
Yeah.
ser gratis.
No deben de pagar por la vacuna ni por la cita. A lo mejor van a preguntar por seguranza, y la única razón de que van a preguntar por seguranza es para tratar de cubrir el gasto de la cita, de dar la vacuna. Pero si alguien no tiene seguranza, no quiere decir que no puede recibir la vacuna, nada más quiere decir que van a guardar esos recursos, ese dinero para cubrir la cita para las personas que de veras lo ocupan.
So, Protect Chicago Plus es un programa en Chicago donde están tratando de ayudar 15 comunidades.
Sí, son 15. Sí, son 15 comunidades, las comunidades que fueron más impactadas por el coronavirus. Hay una lista y acabo de ver una presentación, y van a tratar de tener sitios de vacunación, o van a tener camionetas que vayan a ir con la vacuna. Pero en esas áreas, en esas comunidades, si vives en esa comunidad y nada más muestras prueba de que vives allí, puede ser por una cuenta, un bill, lo que sea, no se ocupa identificación, con que tengas 16 años para arriba. Entonces, todos los que viven en esa comunidad se pueden vacunar, pero si no vives en esa comunidad, van a pedir que busques la vacuna en otro lugar, o cuando te toca, para guardar esas vacunas para las comunidades que de veras fueron impactadas.
Thank you. Sabina, I'm just looking at the Facebook chat, and somebody said Such a real metaphor. Thanks, Sabina. You were sharing about like the situation in Ontario. So, and then also commenting, which also shows when the majority of people vaccinated are also white. So yeah, like that's what we're seeing here in Chicago. I'm sure you're seeing it there in Ontario too.
Well,
Where it's just like,
actually, in Ontario, I think you guys are doing a much better job. We don't have vaccines. We only just started getting vaccines this week. We had a couple that we got, very little that we got in the month of January, but in February we got nothing basically, and we just started vaccinating yesterday our 80 plus. So it's only for 80 plus right now, and even that not across Ontario, just in some areas. So we're really far behind.
yeah.
But you know, like the one thing that we've also been talking is because we didn't have vaccines, how do we make sure it's equitable when it does come? And it's very similar to what Dr. Lopez was talking about, making sure the high hit areas, you know, the high areas that have had those high transmissions, similar, I guess, to your Protect Chicago, we have high priority areas that are similar to that. We have said constantly that we need to make sure that the vaccines are accessible over here, making sure that, you know, we're using mobile health units so that we're taking the vaccines to the people, making sure all the information is in language accessible routes. And then we're currently creating this big clunky online website. And again, there's so many issues with accessibility and digital literacy, whether people can know how to book their appointments, especially if they're 80 plus and, you know, they have a language barrier on top of that. How do you expect someone who is 80 plus to be going on this website, filling out all this data and then refreshing constantly because everyone's on at the same time?
Yeah, it's like a digital divide, you know, like
Huge.
I managed to get my mom her appointment, but we were like, what about people who don't know how to use the internet or don't have like family members who can help them, you know, with that urgency? I can't get my dad, he works in manufacturing, like I can't get him an appointment. It's just everything is just like a hot mess. Dr. Lopez, can you kind of go back to what you were saying? So like the vaccine should be free and you shouldn't need, like, you can be undocumented to receive it. It's more about like proving if you like have a bill or something to show that you live in an area, or like because it is so decentralized, like we have moms who have seen some places who are asking for like an ID and all of that stuff. So like what about people who are undocumented, don't speak English, don't have any kind of like these kinds of IDs, or even if they're like they got stuck here visiting a family member and they can't go back, like how do those people get the vaccine?
Yeah. So one of the other things that the city of Chicago is going to be doing, like we were talking about that digital divide, they're actually going to have like people canvassing in some of these neighborhoods, like basically going door to door, paper registration. They're going to be asking for name, obviously, date of birth to make sure you fit the age group, email and phone number, like to figure out when to coordinate that second vaccine, phone number, so you can register for VSafe, which is how the CDC will kind of keep track of any symptoms you're having after. They'll send you text messages and you just answer some questions. So no matter what, all of the vaccines in the United States, they're free. They're being purchased by the government. They're being distributed by the federal government to each state, and then the state determines how they're going to distribute that throughout the state. So no one should have to pay for a vaccine whatsoever. No one should be able to jump ahead in the line to pay for extra for a vaccine. And then some places are asking for insurance, but again, really they're only asking for insurance if like for clinic fees so they can administer the vaccine, but you don't even need insurance. They just want to make sure that the funds, the emergency funds that they have to cover any of those costs are used by the people who absolutely need it. In terms of people who are undocumented, anyone can get the vaccine.
Spanish?
Huh?
Can you say that in Spanish?
Yeah. Yeah, entonces todas las vacunas están compradas por el gobierno federal y el gobierno lo va a mandar a cada estado va a decidir cómo se lo va a distribuir a las ciudades adentro de ese estado. Entonces, nadie debe de pagar por la vacuna, nadie puede pagar extra para tratar de recibir la vacuna más temprano. Y también hay algunas clínicas que a lo mejor van a pedir por seguranza y es nada más para tratar de, si hay un gasto para la cita para darle la vacuna, pero no se ocupa seguranza. Hay recursos para esa gente que no tienen seguranza. Nada más quieren guardar esos recursos para los que de verdad lo ocupan. Y luego no tiene que ser documentado. A lo mejor van a pedir pruebas de domicilio para asegurarse que eres de esa comunidad que fue impactada. Puede ser una bill, una cuenta, no es, nada más es para asegurarse, van a pedir por nombre, por fecha de nacimiento para asegurarse que tienes la edad que debes de tener, por domicilio para asegurarse que eres de esa comunidad. No se ocupa identificación. Si alguien le pregunta, pueden platicar al 311 para clarificar, porque hasta ahorita es lo que hemos recibido del Departamento de Salud de la ciudad de Chicago. También van a pedir email para tratar de coordinar, email o número de teléfono para coordinar la segunda vacuna. Pero también para recibir esos textos. En ningún punto deben de preguntar si eres documentado o no.
Yeah, Cecilia saying, I think a lot of people undocumented are scared to come forward to get the vaccine, and oftentimes they're the ones who need it the most. Like,
Yeah.
la gente tienen mucho miedo si están indocumentados y van
Sí,
a algo que está conectado con el gobierno. Hay mucho miedo ahí. ¿Qué podemos
sí.
hacer para apoyar esa comunidad?
Lo primero, yo creo que yo creo que el gobierno debe de ser un poco más claro con las recomendaciones, no con las recomendaciones, pero Border Patrol y también ICE han dicho que no van a tener trabajos o no van a ser, no van a estar trabajando cerquitas de sitios de vacunación. Ni cerquitas de clínicas que van a tener sitios de vacunación. Pero también la otra pregunta que he recibido es que si va a impactar el cargo público, que alguien que vaya a impactar que alguien vaya a poder recibir la tarjeta verde o residencia. No lo impacta. Ahí lo tienen en su sitio. Es muy complicado como lo dicen, pero no impacta el cargo público. Entonces, buscar cuidado médico, vacunas contra COVID, lo que sea, si es situación de emergencia, no impacta el cargo público. And I'll just say that in English really quickly. It's hard because you really want to gain the trust of communities, especially immigrant populations or those who are undocumented. And I think as a medical community, as a government, I think we just need to be more clear and say, this is free to you. It doesn't matter if you're documented or not. It's not going to impact the public charge rule, which says that, if you become a charge or have to rely on the federal government, you can't qualify for permanent residence or your green card. But very clearly on their website, it's the immigration website. It's really long, but if you read it, essentially it says, if you need medical care, emergency medical care, if you need the vaccine for COVID, it does not impact whether or not you're considered a public charge. That has nothing to do with it. It's an emergency. It's a pandemic, and you should be able to get the care that you need. Same thing for hospitals. It doesn't matter if you're documented or not. You're human and you need medical care. Come here. You may not have as many resources, but there are resources. We're not going to turn you away, and immigration will never know that you're at the hospital. We never communicate with immigration.
I think like a big thing, like, I can only speak to this from like the community side, like as a community organization, and like the conversations that I've been able to be part of like kind of bridging the gap of like health, life expectancies or mortality rates or anything like that, like access to healthcare, like it just, for the Latino community, it seems like it is best to collaborate with community organizations, community groups who have the trust of that community, and collaborating with them to do the distribution of information or care or whatever, because it's more likely that, you know, someone, you know, would be like, oh, CLM got a, I don't know, like what did we call, like a mobile clinic, you know, and it's through CLM, like I know that they wouldn't like have ICE like hiding in the back and say surprise, right? Like that we've earned the trust of like our community, and there's so many amazing organizations like everywhere who are doing the work and who know the struggles of communities, and like it just seems like there needs that partnership to access like those vulnerable, scared communities, and to also help distribute information. One of our board members, she got us connected so that we can sign up to be like a COVID advocate, and so like so that we can help share information and give them feedback about like how people are receiving that information. But I do think that it's like it's a lot of fear, it's some misinformation, and like it's really tricky to know who you can trust.
Yeah, and I think that's why the Protect Chicago Plus is so important, because their main goal is to work with community organizations that have been in those communities for years and years and years and have that trust. And even on the call this morning, they're like, hey, if you guys want to partner with us, go ahead and give us a call, shoot me an email. Like they're still working to get those relationships. They have some, but they're looking for even more organizations to partner with, which I think is really good.
Yeah, we're actually doing something very similar here as well with our high priorities. It's all basically community organizations that are spearheading it, because I think the government realizes that BIPOC people do not have that trust in the government here as well. It's actually very similar. Do not have that trust with public health, do not want that top-down talking at approach. We want to be, you know, they want to work with the BIPOC organizations on the ground level, because they have the trust and the relationship with their communities. So leveraging that is so important. And as an example, I also want to say, you know, and I think the US is doing this. We're not doing it here in Canada, but in the UK, we saw there's one of the groups that has the highest vaccine hesitancy actually is the South Asian community there, for very similar reasons to why it is here in Ontario, because they make up a huge part of the UK population. But again, they're the ones who are the most marginalized there as well. And what the UK did, the South Asian communities actually had the vaccines in mosques and in Hindu temples.
Yeah.
And they saw such a huge success in vaccine uptake once they were actually doing it at the community level in a place where people had trust. And what they also did is like these community organizations worked with the imams, the pundits, they are basically our religious leaders. And you know, so if anyone came in with questions, when we're concerned about, you know, something about the vaccine, their own religious community members and leaders were actually giving that information to people. Yep. And I think that is just so incredible and so beautiful, because that's really how things should be done. And I think that Canada has a lot to learn from some of these models. And I know that in the US, you guys have also spearheaded similar initiatives, which I think is just incredible.
I mean, not to mention like like when I hear like a distrust different from misinformation, the distrust, I mean, I can only speak for the United States. I don't know enough about like Canadian history, but I know some, and I wouldn't find it surprising, the distrust, because there is historical medical abuse of communities of color. So it's not it's something that needs to be acknowledged, because I think that it's like, oh no, it's fine, just get the vaccine. It's like, no, we need to acknowledge that there are a lot of historical situations that have happened where we've been used as guinea pigs, or you know, all kinds of horrible stuff. And
it's very similar to like, especially when I have community sessions, like one of the things that I say, I was like, look, I know there's mistrust, and you have every right to have mistrust. You know, I'm Latina, but I'm also part of the medical institution, and I have to recognize and acknowledge that historically there's mistrust, and I understand why there's mistrust. I acknowledge that the medical community has done wrong by the communities of color, and I know it, I recognize it, and I say I'm sorry, and but these are the things that we're working with. We know, it's like, now that you know better, you have to do better, and that's what we're trying to do. We're not going to be perfect at it. We're going to have to keep getting better as we go along, and so it's just, yeah, when you know better, you have to do better.
Yeah,
Yeah,
and we need voices like yours, right, in that discussion, who have that background and connection with the communities that are being impacted. Like, you guys are, it must be like a tough place for you guys to be, like you have like one foot in one community and one foot in another, and you have to balance that all of the time. An invisible labor that people of color have to carry in their professions, so we are going to get to the breastfeeding and pregnancy question. We're not there yet, but we will get there. Someone had asked, like, if you didn't get sick but have been exposed several times, is it still beneficial to get the vaccine?
Yes. Yes is a short answer. Sí, sí da beneficio recibir la vacuna. So even if you were infected naturally by COVID, or you were exposed and didn't have symptoms, it doesn't mean that you weren't infected. Unless you got tested and came up positive and didn't have symptoms. There's a lot of people who were infected and didn't have symptoms, but essentially, regardless, we are recommending the vaccine to anyone who feels comfortable getting it. And the only reason for that is the vaccine provides a lot more protection than recovery from natural infection. We know that most people have at least, we're guessing at least 3 months or 90 days of antibodies to protect you from getting very sick. But with all these variants, we don't know if that protects you enough. The vaccines, at least right now, are providing a way better immune response. Better protection, longer protection than if you had recovered from infection or were exposed and don't even know if you got it or not.
Yeah, I'm gonna stop sharing because that's all the questions that I had kind of like preset, but I did get a few, and the next question that relates to what you were saying, Susie, like, what if you had COVID and you just didn't get it as severe as other people? You didn't have to be hospitalized. Like, it just it sucked and you were in bed for a while, but you otherwise, like, you had it a lot better than other people. Like, would the vaccine prevent you from getting sick the second time around?
Yeah, the idea right now is, yes, it would prevent you from getting sick the second time around, or hopefully not getting sick from a different strain or a different variant.
Mm-hmm. Sabina, like, is there a vaccine that's more effective than the other ones that are out? So we've been talking about Pfizer, Moderna, Johnson & Johnson, I think, just got like the green light, like, and I know they're all like a little bit different. Can you like share about, like, is there a better one that we should be trying to get?
Yeah, so in my opinion, you get the one that's offered to you. That really is, I think, the best course of action. Like, every single, trial had their own efficacy endpoint slightly, but I think what was ubiquitous what we've seen all through all the vaccines that are currently in development is that they were all very, very effective in preventing severe illness, very, very effective in preventing hospitalizations, and in fact, every single one of them prevented death. So there were 0 deaths in all of the groups that got the vaccines. And so that, I think, is like the most important aspect, given, as you were saying, Isabel, before, the US has reached 500,000 deaths nationally. I think that is, so critical to make sure that we're not losing any more people and any more lives. And what I really want to emphasize is that Pfizer, Moderna, J&J, and in fact, even AstraZeneca, every single one of them basically prevented deaths in every single vaccine. So that is the most important efficacy endpoint that you should remember.
Yeah, so dice Sabina que lo más importante de todas las vacunas, porque sí hay como 3 ahorita, pero lo más importante es que todas no van a prevenir que te va a dar el virus, pero sí van a prevenir muerte, ¿verdad? Y eso es muy, muy importante. Cecilia is asking, how credible is Johnson & Johnson with their past history? So this is where we were talking about, like, like taking into consideration the distrust that we have in communities who have been abused. And like, I can totally see someone being like, I don't want the J&J one because of their history. Like, I want to go with another one. Like, what do we know about the Johnson & Johnson vaccine, and like how people like us could feel comfortable with it?
I'll tell you one thing really quickly. The stuff that we've seen in the past with J&J, Johnson & Johnson, especially their powder, none of them went through clinical trials. There were no trials on them. There was nothing in terms of safety, because those are products that don't go through such rigorous testing at all. Whereas for the J&J, for their vaccine, they had a robust full clinical trial program. They had thousands and thousands of people who were enrolled in their studies, and it was all independently monitored by the data, the Drug Safety Monitoring Board that is part of the trial, which is not part of either the investigators who are the clinical researchers, and not part of anyone. They're just completely independent. They're watching every, every case, any adverse event that comes up in the trial. They are very independent on it throughout the entire trial. And then you have FDA that approved it. They're all independent, and they're all, making sure that every single data point is analyzed. All due diligence is done for safety. That didn't happen with the issue we've seen with J&J on their powder. I think that's where all of the issues were in the past, if I recall correctly. But Dr. Lopez, I'd love to get your thoughts on this as well.
Yeah, I think when we're looking at these things, the number one thing is the FDA here in the US will not approve anything unless they provide the data that things are, number one, safe and effective. And I think the other thing you have to take into consideration when we're talking about communities of color is that what proportion of people in these studies had different medical issues? What proportion of the people that participated in these studies were from these communities of color? Communities of color typically don't participate in research because of that history of mistrust. But I think, it's definitely not where it needs to be. But Pfizer, Moderna, and J&J, I would say, they did a good job. They worked really hard to get more communities of color to participate in these studies. I think usually along the lines of like 6 to 8% will be like from a community of color, whether Black, Brown, Native. I think on average, all of them have ranged about 13 to 15% from those communities. So it's not where it needs to be, but those numbers are there. So if someone asks me, is this safe for someone like me who is from a community of color, or maybe they have a medical condition, I'll be like, yeah, we have the data to show it. All of them have 30 to 40,000 people in it. And they had a nice mix of people with different medical conditions. And on top of it, the FDA is a panel of experts from all different specialties, just pure microbiology, clinicians, epidemiologists. They review everything and they vote. And so it's really rigorous. There's a lot of steps. None of them were skipped. It just happened really fast.
Yeah, I like, coming from academia, like I did work with some like medical students and faculty. And I think that was something that, the general population doesn't know, is that like scientific research and like papers that get published and all that stuff, it's like a really rigorous, very like, basically, like, can you replicate it, right? And that's like what the whole thing is about. And so there's a lot of frameworks that need to be used to do that. And so I know people are like, why did it get created so quickly? Well, because basically the core of the vaccine, like it's we already had that, right? And then we're just trying to like adapt to what we don't know. And so like the hard part the core of it was already set, and we just had to, so it's not like creating something completely from scratch, right? And really quickly, like the Pfizer and Moderna vaccine will be still available when Johnson & Johnson is available, right? It's like we're just going to get more access, right?
Right, exactly. So people will have the option if they want to go as far as to like figure out which vaccine site has which vaccine, they can choose to do that. It might just take them a little longer to get it because it's a little more tedious. But honestly, when it comes down to it, the best vaccine is the one you can get in your arm as fast as you can.
Mhm.
Mhm.
Um,
Agreed.
how, so we kind of talked about this a little bit in the beginning, but like how effective are the vaccines against the variants? Like I think you kind of mentioned it a little bit, Susie, like we know the main thing to know is the vaccine is going to protect us from hospitalization, severe symptoms, and death. But like, can you kind of like condense all of that and just say like,
Yeah,
how does that protect us from the variants?
yeah. So right now, so when people hear effectiveness for Moderna and Pfizer, it's like 90% or more. I think one thing that people also have to keep in mind, those studies were done when we didn't have variants. So they were way effective, immensely and greatly effective against the original strains, against the original strain. Um, so, we don't know what that effectiveness is now. We're gathering data to figure out what it's like in real life situations. Johnson and Johnson, they did it in Latin America, South Africa, and the United States. There's different effectiveness in each of those areas. And it's a little less effective where there's more variants. So like in South Africa and Latin America, it was along the lines of like, I think South Africa was like 57, 60%, Latin America was 66, and then the US was 72% effective. The minimum amount of a vaccine could be considered effective is it has to be 50% or more effective. That's what they were going to even consider to have approved in any country. So that was kind of like the requirements that they set out when they told everyone, go ahead and make vaccines, make sure it's at least 50% effective. So at least right now with J&J, we know that in the US, it's 72% effective or more, or at least 72% effective. And that's against these strains. But once these things get approved, it's depending on the technology, they can adjust them kind of like how we adjust the flu vaccine every year. So they can adjust to them for the strains and they don't have to go through that whole approval process again. They just have to prove that number one, it's safe, and they'll be like, okay, great, go ahead and distribute it.
So we're getting to the questions that everybody wants to know about our babies. So breastfeeding and pregnancy. So moms want to know, like, if they're pregnant, like, do you recommend, is it safe for them to get the vaccine? I know that in the beginning there was some conflicting information because like people were saying their doctor said no, and then now they're saying yes. So like people are kind of like confused about that. So like, is it safe for pregnant people to get the vaccine? And like, what can you get the vaccine if you're currently breastfeeding, and like anything that we know about like fertility? I know like those are like a lot of people have questions about pregnancy, newborns, fertility.
Yeah. Or Sabina, I don't know
No,
if you
you
wanted
go.
to.
You go. You can. You can start. You know what? How about you do you do pregnancy, breastfeeding. I'll do fertility.
Okay, great. So when the FDA approves things, the original studies for all of these vaccines, Moderna, Pfizer, J&J, did not look at safety in pregnancy. But if you imagine 30 to 40,000 people, there were some women who just ended up being pregnant. They didn't realize that they were pregnant. Those women did not have issues during their pregnancies. And they're continuing to follow those women. Some of them have given birth already, and they're going to follow those kids. No major long-term side effects for them. So they are going to start to do those studies to make sure that the vaccines are safe and effective in kids and specifically in pregnant populations. But so we don't have that data, but we have some information, right, about like these women who did end up getting pregnant throughout these studies. So it's really a personal choice for people to have with their physicians, but at least right now, the American College of Obstetricians and Gynecologists and a couple of other organizations have said basically the risk of a pregnant woman getting sick with COVID and doing really bad the risk is bad, right? So if the women in the studies did well and their babies are doing well, they're saying, yeah, go ahead and get it if you feel like it's safe for you. With other vaccines, women who do get vaccinated and are breastfeeding in the past have been shown to pass on their antibodies and protection to the baby that's receiving breast milk. And that's kind of again, we don't have the final information on these studies. We're still getting information as we go. But at least right now, those studies right now are telling us that moms are passing on antibodies to baby, and we don't know what level the baby needs to be protected, but it's good news to hear that, hey, those antibodies are in the breast milk and the baby's going to be getting some of them. So right now,
No, so please finish your thought.
Yeah, so if someone feels comfortable doing so, I've had colleagues and residents who are pregnant and or breastfeeding, they have been getting it. They feel safe enough doing it. The FDA hasn't, quote unquote, done emergency use authorization or full approval for that indication for someone who's pregnant or breastfeeding. But right now, the data that we have says so far that we know it's safe to do so, and someone can get the vaccine if they feel comfortable receiving it.
On the topic of breastfeeding, I spoke with a mom yesterday who said that she got the vaccine. She's breastfeeding her 4-month-old, and she actually joined 2 studies, which I think is great. I think that's wonderful that to be able to report back like anything with the vaccine and like breastfeeding. But she's like, just what I can say from this is one person's experience, but she said like the only thing she noticed that, I don't remember if it was the first dose or the second dose, but that her baby had like a little bit of loose stool for a day. It must have been the second dose, because I know that like it hit me pretty hard. Like I felt like, oh, tumbadita, and like, like you were sick. So she was like, my baby, just had a little bit of loose stool, and like that was it, right? But yeah, like there's a lot of studies that need to happen so we can like know that.
I just wanted to quickly. Oh, sorry. Yeah, I just wanted to quickly clarify on the breastfeeding side of things. But we know with other vaccinations that, even though it does pass a little through the antibodies pass through breast milk, they don't necessarily protect the infant per se, which is why infants still need to get their full dose of vaccinations on time, on schedule because of that. And I think that what I want to clarify also with the, or explain rather, with the diarrhea that the infant had, which makes sense because actually the antibodies that you pass predominantly through breast milk are your IgA antibodies, and they're the secretory antibodies, and they work basically in your mucosa, which is basically your stomach. Has those receptors for these type of IgA secretory, which is why often the antibodies in breast milk really help to prevent GI infections in infants because of that, because it actually works in the mucosa, so that the little infant having a little bit of a watery poop, sort of makes sense actually with respect to what is being passed to the breast milk, which is very neat.
I gotta make sure I translate because I want to hear, Sabina, what you were going to say about fertility. Que si estás amamantando y quieres tener la vacuna, dice la doctora López que esa es una decisión que puede tomar. Lo que sabemos ahorita es que es seguro, pero también hay muchos estudios que están haciendo para ver qué efectos pueden tener, pero de lo que ven ahorita está bien, pero es una decisión personal que tiene que tomar si se siente confortable tener la vacuna. But yeah, people want to know about fertility.
Yeah. Okay. Yes, I'm happy to talk about fertility. So I think the guidelines in the US is similar to the Canadian ones in that, with the CDC ACIP as well as with the Canadian Health Canada guidelines, there is no contraindication with getting pregnant or getting the vaccine when you're trying to get pregnant. And all of these concerns on fertility, I just wanted to explain actually why they came to be. It's because some people said that there was this one protein in placenta that was kind of similar to the spike protein that you see on the surface of the virus that causes COVID-19. But actually, if you look at it, the proteins are not at all similar. They have like these little stretches that are similar, but that's expected because all proteins are made of 20 amino acids. These building blocks, there are only 20 of them, and you have to put these 20 amino acids to form these large proteins, like the protein in for the spike protein is 1,000 amino acids long, right? And so obviously you're going to have certain areas of one protein be similar to another protein. It doesn't mean it's actually the same protein, because even after all these amino acid blocks are formed, the protein basically folds into a really neat 3D structure, and that's so different and unique from one protein to the other. So really, there's no cross-reactivity between this protein that's found in the placenta and the protein that is found on the virus. And the other thing to remember is that, if you expected to see that the spike protein would cause an issue with placenta and fertility, then you would have seen a high rate of miscarriages with COVID-19 infections. But we don't see that. We see other impact in pregnancy. We see that the mom doesn't do very well, the mom needs hospitalization, but that has to do with the mom. We don't see that with respect to actually having a high rate of miscarriages, right? And so really with fertility, with ACIP as well as with Health Canada, the guidance is the same, that there's no actual concern with respect to it impacting fertility, and there's no need to delay fertility. Or if you're conceiving, you don't need to delay that. And or if you're between doses, you got the first dose and then you get pregnant, you don't have to delay your second one because of fertility either. So I just wanted to clarify why this came into question and why there's actually nothing to worry about there.
Thank you so much. Yeah, for anybody that's watching, like, please let us know if you want clarification on anything. This is your chance to ask your questions and get like legit answers to it. Please let me know. I'm watching the chat and trying to make sure I don't miss anybody. If I haven't asked your question yet, I will get it back to you. I'm just trying to stay within like the kids. One of the questions is Dora asks, what about pregnant women who contracted COVID? So people who were pregnant, got COVID, they can still get the vaccine, and it just protects them from like when they get the vaccine and on, right?
Right. Yeah. So at least so right now we're asking that anyone who has recovered from COVID wait the 3 months, because we know you're protected for at least 3 months. So we're trying to get the vaccines to those people who are really vulnerable, who are going to get really sick. So if you have a little bit of protection left, once you get that 3-month mark after recovering from COVID, go ahead and get the vaccine. So they can totally still get the vaccine if they got the virus while they were pregnant.
Okay, so
Dr. Lopez, I have a question for you on that. Would that be similar even for those who are pregnant, given that they do have lower, are more immunocompromised in that position? Would you still have the 3 months, or would you actually recommend someone who's
I don't think we have
pregnant?
the information on that just yet. Yeah, we don't have the information on that just yet, but at least for right now, the information that we have is if you've recovered from COVID, go ahead and wait the 3 months or 90 days from when you recovered, and then go ahead and get the vaccine. And then I guess
you're recovered, like you get a COVID test, right?
Yeah, like they would have had a positive COVID test or maybe symptoms or not, and then 90 days from that positive.
Mm-hmm.
And then I guess I'll just translate the fertility question.
Yes.
Okay. So la pregunta era sobre si la vacuna puede causar infertilidad. Hasta ahorita no lo hemos visto. Habían algunas teorías que los anticuerpos o la proteína spike iba a impactar la placenta, pero eso no lo hemos visto. Es seguro, las vacunas no causan infertilidad. Si hubiera visto problemas con infertilidad con el virus o con los anticuerpos, hubiéramos visto que que personas que estaban infectados con el coronavirus y que se recuperaron hubieran tenido problemas con infertilidad. Y hasta ahorita no lo hemos visto, no hemos visto que la gente que se han recuperado tenga problemas con tener niños después.
Thank you.
Yeah.
Susanna is asking, has there been an estimate as to when a pediatric COVID vaccine will be available? And I want to add to her question, because I was thinking about this last night when I was thinking about, like, oh, what are my questions? When we do roll out because I know they're starting to do the pediatric COVID studies. I know that that's even happening in Chicago, right, Susie? Like, right?
Yeah, I believe Pfizer has finished enrolling in theirs. Moderna is still in the process of enrolling for their studies. And I think it's 12 and up.
Oh, okay. So not even like super young.
Yeah.
I was thinking about rollout because that's like where my head is all the time, where I'm like, why is it so hard to get the vaccine? Like, would they roll that out as a separate thing? Like okay, now we're doing kids. First we're doing like compromised kids, and then we're doing kids who come from impacted communities. Like, would it be tiered distribution as well? So I know that's a lot. When do we think the COVID vaccine will be available for kids, and like what are the ages there, and like would that be rolled out in a tiered fashion as well? You think? You can't.
Yeah. I mean, it's hard to tell. So the FDA will never approve anything that wasn't studied. So right now it's approved for Pfizer 16 and up, Moderna 18 and up. And so right now, like we mentioned, Pfizer and Moderna have started enrolling for ages 12 and up. They'll need to do that study and then collect at least 2 months of data after completing the vaccinations, and then submit that to the FDA to approve it for those ages. So we're guesstimating, we're hoping by like late spring, early summer, maybe May, we'll have approval or at least emergency use authorization. And then they'll have to go and like expand those trials to like even lower ages. So it's going to be like kind of a stepwise situation with pediatric vaccinations, because the doses might be a little bit different, especially for younger children. So we're hopefully by May, June, we may have vaccines available for kids 12 and up. As for the actual rollout, I'm not quite sure. I don't know if that's going to be something, because now we're dealing with school age kids. Are we, rather than community-based organizations, are we going to be partnering with schools and things like that? I don't know what the details of that would be, because I think unfortunately with the vaccine rollout, no one was prepared for the vaccine rollout. I think as much as we were excited, I think I really wish things would have been better organized. And then you're asking healthcare providers and all these healthcare institutions that have been slammed and completely burnt out by this pandemic to then go ahead and like individually try and figure this out. And it should have been done better, but I think we're getting better at it. But hopefully by then we will have a plan for the rollout for children.
Sabina, do you want to add anything about kids? Because my next question is not about kids.
No, I think that Susie basically covered it. I think we're still a ways away for under 12. We'll probably nothing until later in the year for under 12. But in Canada, actually, interestingly, our ACIP, we call it NACI, we're actually in discussions as to whether we should do off-label use for the 12 to 15 high-risk children group. Those who are, immunocompromised, especially those who have cancer, patients who are children who have cancer, etc. Should we be considering the vaccination for them even before there is actual official approval? So we're having those discussions right now because of that. But otherwise, it's basically the same as Susie mentioned.
Susana Perez says, very specific question. I have an elderly parent that just had a pacemaker placed last month. Is there any concern as to which arm they receive their COVID vaccine? Scheduled for their first vaccine on Friday. So elderly parent got a pacemaker. Does it matter which arm it goes in?
Oh, you're muted.
You're muted.
Susie, muted.
Sorry. So pacemakers typically go, on the left side. The vaccine is usually given on the left side. There really shouldn't be any indication for putting it in the left side. I think there were questions about side effects. Most common side effects are going to be like, injection site pain, maybe a mild fever, fatigue, I feel like was a big one, especially for me. But I think the other thing just to kind of keep in mind is I had a little bit of lymph node swelling. It was just like, I was actually kind of excited. I was like, go little lymph node, go. Because my immune system was like, yay, my immune system's like making antibodies. So just keeping a close eye out. If it's been a month, that pacemaker site should be healing really, really nicely. But just keeping in mind, like, if there are some little lumps or bumps, some of that maybe tender the first 2-3 days, it'll go away, the swelling will go down, but definitely at least chat with the cardiologist about any other signs or symptoms they should look out for that might be signs of an infection of the pacemaker site versus their immune system, just mounting a response.
Yeah, when I got my second dose, my armpit hurt. Like whatever lymph node you have like around here, like I felt like sore there, and I was asking my doctor, and they're like, oh yeah, because you got it like here, so it's your body's working.
For me, it was like right here, like and there's some other, like, if don't Google it if you have it in another random spot. Google and Medscape will tell you all sorts of things, but yeah, it was right here and it went away in a couple days. It was fine.
Okay, so we've gone through all of our questions. Oh my goodness, thank you both so much. Like I can't tell you how grateful I am that both of you agreed to chat with me and to answer like so many of the questions that we've been having in our community, and just like worried as moms, as frontline workers. I mean, a lot of people who are essential workers or who are vulnerable, they are like, hell yeah, give it to me, like I'm getting it and everybody in my family's getting it, but there are a lot of questions and misinformation and distrust, and those are very I think valid questions and important for us to explore. Dora says thank you, very informative. I'm really, really grateful to you both, because I know that we all had a crappy year last year. I cannot imagine like how much more it was for folks who were doing the studies, who were going above and beyond and being on the front lines. Doctora, cuídate mucho, please, because you're taking care of a lot of people and we need you. The community needs you. Sabina, just thank you both so much for doing all the labor that I know you both have done and will continue to do. I worry a lot about like our therapists, our healthcare workers, because if you're taking care of other people, I hope you guys are taking care of yourselves too. And I'm just really, really grateful to you. And everybody's saying thank you. Gabriela says thank you. This was very helpful and also so interesting to compare / connect with on the ground efforts in Chicago and Ontario. Yeah, thank you so much for that, Sabina. Like I think it was very interesting. It was a very interesting layer to this conversation to see like how things differ yet are similar in different parts of the world. And yeah, everyone's saying thank you so much. So important question, last question. How long after the second dose is someone protected? Thank you, Rebecca. I did miss that. Thank you. 2 weeks.
No, not protected. Like how long the immune response lasts?
Yeah. Like when you get the vaccine, like for how long are is it protecting you?
It won't get full. So you'll get dose 1, dose 2. You won't have full effect, or at least gotten to that 95 or at least 72% effectiveness until 2 weeks after. We don't know how long the protection from these vaccines is going to last yet, because it hasn't even been a year since we've had these vaccines. So, but our estimation is that the rough estimation is maybe 1.5 to 2 years, but depending on the variants. That's why I think we're talking about this being kind of an ongoing thing, likely very similar to, annual flu shots, at least for the time being.
Do you guys have anything you want to add before we say goodnight? Thank you for, what time is it over at you, Sabina? It's like an hour ahead,
Oh,
right?
yeah,
10 o'clock.
it's 10 p.m. No, this was amazing. Thank you so much for having me. I really enjoyed having that conversation. And also, I think that compare and contrast against what's happening here and what's happening in Chicago was really interesting for me as well. So I learned a lot as well from you guys today. So thank you.
Yeah, no, thank you for having me. I'm always happy to talk and help answer some questions. It's normal and natural to have questions, and everyone should be able to have the opportunity to get those questions answered. So the goal is not to force people to have vaccines, but get the information they need to make the best decision for themselves and for their families. So si tienen preguntas, es completamente natural. Platiquen con sus médicos, con gente para recibir respuestas a sus preguntas para que puedan hacer la mejor decisión para ustedes y sus familiares.
Special shout out to Rebecca Langford for connecting me with Sabina so that we can have this conversation. Rebecca was actually the one who reached out and she was like, hey, we need to have a live where we're getting real answers to these questions. I'm a little bit worried. So thank you, Rebecca, for being worried, for caring about our community, and for bringing us all together.
Rebecca's awesome. She's so awesome.
Yes, she's not. I love you and appreciate you, Rebecca. And sending my love to both of you. Sabina, Chicago is your sister. So anything that you want or need, or whenever everything is safe and you can come to Chicago, I'd love to meet you in person.
Thank you so much. And I also would love to meet you in person. I actually miss coming to Chicago. I used to come every year for ASCO, which is the clinical oncology conference. And so I was there every single year and I kind of miss it.
Yeah.
Yeah.
Well, we'll
One
see
day.
when
One day.
Cuídate mucho, doctora. Thank you so much, Sabina. Take care.
Take care. Bye, everyone. Have a good night.
Night.
Bye.